Looks like there are going to be a lot of people joining us in a moment, but let's go ahead and get started in the nature of time. So I'd like to welcome everyone for joining us today. On behalf of my co-chairs, Drs. Jenny Shang and Karen Smith at the Johns Hopkins Breast Cancer Program, we'd like to welcome you to our final three-part webinar on COVID and breast cancer. My name is Alyssa Thorner, and I'll be moderating this event for today. Over the next hour, we'll be discussing breast cancer survivorship and how this may be impacted by coronavirus. The purpose of today's webinar is to address medical, psychosocial, and lifestyle changes that may be impacted by the virus. During today's webinar, we'll be hearing about endocrine therapy from Dr. Rima Kuzi, lifestyle changes from Jenny Shang, psychosocial concerns from our social worker, Don List, primary care issues with Dr. Kim Piers, and follow-up imaging by Eni Oloyami. We'll also be hearing from one of our very inspirational patient advocates, Megan Hosey, who will be here to discuss changes that she's had to experience on Zoladex, modifications to her MR and mammo schedules, as well as doing physical therapy for lymphedema via telemedicine. Just a few housekeeping things before we get started. As I mentioned, I have your line muted and your camera off. At any time during the presentation, if you have a question, use the chat feature that comes directly to me here at the very bottom of your screen. Your questions will come here and we'll get to as many questions as possible before the hour is up. If you missed any of the presented material or you want to see it again, we're recording today's session and we'll be sending it out in the coming days. And finally, and this is really important, at the end of today's presentation, I'll post a survey link on your screen and in the chat feature. If you could take just a couple minutes and fill this out, it'll really help us to figure out how we can do a better job and other things you might like to see. That's about it from me. But I'd like to go ahead and turn it over to Megan. Hi, Megan, are you there? Great, can you hear us? Let's see, are you on mute? Let's make sure you're off of mute. Okay.
Here I am.
Very good, thank you. Hi, Megan. Can you tell us a little bit about your experience and how COVID has really impacted your care?
Sure. So just to give people some context, I was diagnosed with stage 2B triple positive breast cancer in 2015. And since that time, I've been treated with chemotherapy, radiation therapy, and endocrine therapy. So coping with COVID is really interesting from a cancer survivorship perspective. I think part of what's helped me so far is grounding myself in the fact that I had amazing treatment here at Johns Hopkins. I had an oncologist who was very open and eager to help me understand the treatment as well as the risks and benefits of treatment. I had a surgeon who was phenomenal and did a great job with resecting my tumor, even held my hand during surgery. And I've had an amazing advocacy team all the way through with Young Survival Coalition. So I would just say to any survivors listening, you know, we are really facing something very challenging with COVID, but all of you had the skills to manage this just by the fact that you've survived cancer and treatment. So ground yourself in the fact that you've got all that experience behind you. So some of the things that I've adapted along the way are my endocrine therapies. So my prescriptions are now delivered to me at home instead of me picking them up at the pharmacy. I was able to do that by navigating with my insurance's prescription plan. I'm doing home injections of Zoladex to help with ovarian suppression. And I was able to do that by communicating via my chart with my providers and watching the video that they put together about how to do the self-injection. That was one of the more intimidating parts of COVID and cancer survivorship at the same time, but it is doable. Another thing that's been interesting is I had an MRI and a mammogram scheduled and didn't even have to reschedule. I was able to go to the Green Spring Clinic, and when I got there, there was checking There is, for things like temperature and symptoms, there's social distancing, and everybody was masked. So I was able to still safely secure that vital imaging that sort of keeps us on top of any changes in the breast. And then finally, one of the things that's important to me is that my work involves some time in the intensive care unit with patients. You can imagine that during COVID, this is a little challenging. And so one of the things that I did while preparing to be a frontline worker was talk to my oncologist about um, how my immune system is functioning after treatment. So, for example, he went over my recent blood counts and made sure that my immune system was perking along well after treatment, as well as talk to him about any kind of oncology concerns that might be associated with COVID. And that's an ongoing dialogue that we're having now. So those are some of the things that I've experienced and the ways that we're thinking about adapting. And if any survivors have questions for me, I'm open in here.
Megan, thank you so much. That was really helpful. Some of the things that resonated with me that you were talking about that seem really like good, tangible tips, things like delivery at home and injections, ways to minimize exposure in the clinic, are just simple things, but things that I think are really good tips for maybe some people that are listening here today. And I also like what you said about using my chart and using it as a tool. And it's a great way to get in touch with a lot of our providers to make quick changes that don't necessarily require a trip to the clinic or a visit, that we can hopefully make these modifications. The biggest thing that I would say that sort of I heard you say is sort of adjusting expectations. And I think that's something that we've all had to learn with COVID. So really great tips, really helpful. I'm going to turn it over to our next speaker, but hopefully you can stick around and be around for Q&A. I'm sure there are going to be questions from people that are unfortunately living through this right now. So our next speaker is Rima Kuzi, and she's going to be talking about endocrine therapy. Give me just a second so I can pull your slides up, Dr. Kuzi.
Great.
Here we go. Dr. Kuzi, can you hear us?
I can hear you, yes.
Wonderful.
Hi, everybody. Nice to see you all here and joining us on a Friday. I'm going to focus a little bit about the hormonal therapy of breast cancer in the COVID era and what changes we've put in place to make it easier for patients. So next slide. Just simple thing about hormonal therapy. Why do we give hormonal therapy? Because there are some breast cancers that are fed or affected by hormones like estrogen and progesterone. And typically those are breast cancers that have markers or proteins on the cells, on the cancer. No, go back to the previous one, please. On the cancer cell that are markers for estrogen or progesterone, and those that tend to be treated with anti-estrogen therapy or hormonal therapy. So the drugs that are used, next slide please, are either tamoxifen or aromatase inhibitor. Tamoxifen is effective in both pre and postmenopausal women, and the aromatase inhibitors as a class, it includes drugs like anastrozole, letrozole, and exemestane, and these are drugs that are effective in postmenopausal women. And sometimes, as you heard from Megan, ovarian suppression or shots that suppress the ovary from producing estrogen are given in premenopausal women, and these drugs can be used in conjunction with either tamoxifen or aromatase inhibitor. Next slide, please. Next slide, Alyssa, please. Okay. Tamoxifen works by blocking estrogen on the breast cancer cells, so the cells can, or cells of breast origin cannot see the estrogen, and as a result lowers the risk of breast cancer recurrence. The aromatase inhibitors work differently by lowering estrogen production that happens outside the ovaries. There's an enzyme that we carry called aromatase, and that aromatase converts steroids to estrogen. So the aromatase inhibitors block that enzyme. As a result, we get lower estrogen production outside the ovaries. And the ovarian suppression shots, they work by stopping that signal that comes from the brain to the ovaries to make them make estrogen. So the shots basically make the ovaries go dormant and produce less estrogen and cause temporary menopause. And in that class of medications, there are many drugs, but the ones that we most commonly use in breast cancer patients are Zoladex or Goserelin and Lupron or Leuprolide. Next shot, please. In general, we don't think that the hormonal therapies in themselves, tamoxifen, letrozole, anastrozole, exemestane, or the shots increase the risk of getting coronavirus or getting sicker because of being on them. We don't think that hormonal therapy in itself affects the immune system. Next shot, next slide, please. So what have we done during COVID to help make it easier? Well, telemedicine visits have really helped a lot. A lot of patients who just need a routine visit to check in, see what's going on, discuss the plan of care, converting to telemedicine visits have been very, very helpful. There are some patients who've felt that they needed to come in for whatever reason, and we were still open for business for those patients. And as you heard as well from Megan, phone visits or MyChart messages have been, are always available to discuss and manage side effects and just to kind of check in periodically. Next slide, please. So there have been no planned change for oral medications such as tamoxifen or the aromatase inhibitors. Those continue as before. For patients who are receiving ovarian suppression shots, we actually sent a message by MyChart. Our pharmacist, Neha, was very helpful in pulling all that together. And we gave 3 options. One is to continue the treatment plan as before, come in once a month for those who did not feel comfortable changing their plan of care or did not want to self-administer shots. But we also gave the option of switching from monthly shots to every 3 month shots, different formulations. And for those who felt comfortable switching like Megan did to self-administer the shot at home, that was also given as an option. We got insurance authorization for the shots and transferred the care to home-based therapy. So next slide, please. And this is just, just because hormonal therapy in itself does not increase the risk of getting COVID or being sicker, there are other factors that if you have them, that you've probably read and heard about, which is being older, race, African Americans are at increased risk of getting sicker, gender, male more than female, and those who have chronic medical conditions that are listed here, those who live in crowded areas of poverty, and there are some occupational hazards as well that can increase the risk of either getting it or getting sicker from it. That's my slides.
Thank you so much, Dr. Kusi. Really helpful to get a sense. And I think the good news that I took from your talk is that people that are on endocrine therapy may not be at an increased risk of contracting COVID. So that's wonderful to hear. Thank you for your presentation. I'd like to move on to Dr. Jenny Shang, who will be talking about lifestyle interventions regarding COVID.
Thanks so much, Alyssa. Can you hear me?
We can. Thanks so much.
All right. Thanks for having me. I'm really looking forward to talking about a few specific lifestyle interventions. Next. So obviously, as I mentioned, we could touch on so many topics today, but we're really going to focus on the personal patient burden that really needs to be focused on in terms of survivorship care. And if you look at this figure here, you'll see that there are so many issues that need to be focused on. But today we'll just focus on the purple section, really looking at diet, exercise, what we can do at a very personal level. Next. So we'll first start with talking a little bit about exercise and specific recommendations for physical activity and resistance training, then go into nutrition, a little bit on weight management, as well as sleep. So foremost, there are actual formal recommendations for exercise for cancer survivors, and they are listed as having at least 150 to up to 300 minutes of moderate intensity aerobic activity each week, and I'll go into what that qualifies as, or 75 minutes of vigorous activity. But in addition to that, there needs to be a focus on muscle strengthening, and so the recommendation is to do somewhere between 2 to 3 days of this a week, and to stretch major muscle groups or big muscle groups at least 2 days of the week. So oftentimes when I see patients, I will kind of briefly talk about an initial prescription, which is talking about, what are things that might prevent you from exercising? Sometimes it's pain, sometimes it's neuropathy. Sometimes it's even access. Some people don't have a gym at home, et cetera, or don't have the time necessarily in their existing schedule to allocate time to exercise. And most importantly, I always make sure we set some short-term and some long-term goals. So for instance, for someone who may not actually have a regular exercise routine, I usually say, let's have a goal of exercising maybe 1 time a week, maybe up to 3 times a week, and focusing on light to moderate activities, and including aerobic activity like walking, and just to do 20 minutes at a time. And I found that this is actually a strategy that really helps people kind of simplify this recommendation to exercise. Next. So going into some more specific examples of physical activity, they're really broken down into 3 categories. There's light, moderate, and vigorous. And as you can imagine, vigorous exercise, it can vary for each person based off of your fitness level, but the way to gauge it is you can only really say a few words at a time. And classically, the examples of that are, biking at a pretty fast pace, very heavy gardening or dancing, walking uphill, jumping rope, power walking, certain types of tennis, and high intensity yoga. And then moderate types of physical activity are those which you can talk, but you really can't sing. You can't really have a verbose conversation. And that really varies for what it is for each person. But some examples of that could be actually some people who are wheelchair dependent. That's actually a very laborious activity to keep moving along with that. So that actually qualifies as moderate activity. Brisk walking as well, yoga, Pilates, or biking kind of at an intermediate pace, as well as gardening. And then a lot of the activities that people do on a regular basis from day to day also are considered types of physical activity, but there may not be any noticeable change in breath. It may not feel like you're exerting yourself a lot. And examples of that are, light housekeeping, slower walking, some types of childcare, et cetera. But as I mentioned, this could totally vary depending on where you are. Next slide. And so there are other things that I always try to be mindful of when we're talking about recommendations for exercise. So it's really important to assess whether or not there's neuropathy or lymphedema. So for instance, if you have neuropathy, it can actually be really challenging to have good balance. And so I actually recommend stationary biking as opposed to hopping on a bicycle and going outside. Water aerobics is actually terrific if you have neuropathy. And balance training is actually a critical component of really gaining greater strength and recruiting other muscles to help exercise. And sometimes wearing padded gloves can actually be helpful if people are lifting weights or things like that. In terms of lymphedema, lymphedema actually can occur kind of along a spectrum of time. It isn't always immediately, let's say, after surgery or radiation. Sometimes it actually takes several months or years actually to see lymphedema develop. But really the important things are if you actually have lymphedema and you've been evaluated for it, and especially for a compression sleeve, you should really be wearing that when you're exercising. And we do recommend progressive strength training that actually helps with lymphedema, but it's really important to make sure that you're wearing that sleeve and that you're keeping an eye on your arm. In essence, if the swelling in your arm is increasing significantly, we say more than 10%, you really need to notify your physician. Next slide. Perfect. Thank you. Additionally, I had mentioned previously that resistance training is really important. And so the focus isn't just on, decreasing the amount of, let's say, fat in the body, but also increasing the amount of muscle. And so there are formal recommendations for multi-joint exercises focused on all the major muscle groups. And really, you want to focus on the largest muscle groups first. So that is, as you can imagine, your chest, your back, and your legs, before moving to smaller muscle groups. And you should actually choose a weight that allows you to do about 10 to 15 repetitions. And for instance, when I give people an example of, how do I start doing that? I say, well, let's shoot for maybe 2 days a week, sometimes 3 days a week, and do 2 to 3 sets of 10 repetitions, whatever that is. Sometimes people go home and they have a really heavy book, and for them that is actually something that would be challenging to lift about 10 times. Sometimes they have another item in their house that's like a metal base that's a little heavier, and that kind of fits that example a little bit better. And essentially you want to make sure that you rest 2 to 3 minutes between each of these sets. And moving on to nutrition as a whole, we recommend a low-fat dairy diet, a variety of food, minimum 5 servings of fruits and vegetables, whole grains and protein, and to limit alcohol to no more than 1 drink a day. And then, really encouraging essentially a plant-based diet. So these are new in our guidelines, where we're actually telling people to eat at least half of their diet from plants, and focusing on lower calorie foods and things that are really high in nutrients. Next. And always remember, food is the best source of vitamins and minerals. So when possible, I always say, if you can get it through something that you're eating, that's actually better than a supplement. And I really only recommend supplement for those people who have documented deficiencies, vitamin D, sometimes calcium, especially if they're in therapy, but really don't recommend any other additional supplementation. Next. And just briefly talking about weight management, this is actually a critical aspect of, being a cancer survivor or thriver, is maintaining a healthy BMI. The goal is 18 to 24, but really, if your goal is actually to lose weight, do it in a very healthy manner. Do not lose more than about 2 pounds a week. If you're on a weight loss plan, you do want to have a steady amount of weight loss, but if it's an excess, that could be quite concerning. Continue to track diet and calories, and really incorporate the strength training into physical activity. Next slide. And lastly, just touching upon sleep hygiene, there's more and more literature showing how critical sleep is to mood, to energy, to activity for the day. And so maintaining a regular bedtime and wake time routine every day is really, really important. If you are struggling with sleep, there are a few tips listed on the left-hand side that you could follow. For instance, avoiding moderate to strenuous exercise, heavy meals, alcohol within 3 hours of bedtime, increasing light exposure during the day, and reducing light exposure closer to the bedtime hours, especially phone use or laptop use. Avoiding caffeine for at least 4 hours. Making sure that your room is actually cool and at a lower temperature, and trying actually not to look at the clock or play games on the phone. And if you're having difficulties with sleep, try to limit the number of naps you take during the day to help reset your clock. And of course, if you actually have a sleep disorder such as insomnia, you really should be seeing a sleep specialist, because there may be an underlying medical issue that needs to be addressed. And that may be addressed with cognitive behavioral therapy or pharmacotherapy. Next. And lastly, I just wanted to share some resources in case anybody wants a little bit more information from any of these websites. Thank you so much.
Thanks so much, Jenny, for that. That was really helpful. I know a lot of really great tips. I'd like to go ahead and turn it over to Donald List. Donald List is one of our social workers in the Cancer Center at Johns Hopkins, and he's going to talk to us a little bit about how you can take care of that other piece, that mental health piece during COVID.
Alyssa, thank you. Can you hear me okay?
We can. Thanks so much, Donald. We can't see you. Are you able to turn your camera on? There we go. It's wonderful. Thank you so much.
Sure. So thank you for the opportunity to take a few minutes and share some information. I thought it would be really useful to be able to give just a brief definition. So isolation and quarantine are different things. Isolation refers to keeping people who are sick with the infection from spreading to others. Quarantine is folks who may have been exposed to the infection and are at risk. I'm going to share with you something that I think is completely pretty obvious, but I wanted to validate the fact that how folks feel. During isolation or in quarantine, you're allowed to feel any way you can. What we have found is that folks have very, very strong feelings about this. This is a very challenging time. completely normal to be able to, have some feelings of anxiety or worry, and it's completely understandable. One of the things I think that's important is being able to acknowledge one's fears as well. Next slide, please. Next, please. Thank you. So what do we crave as human beings? We crave normalcy, routine, structure, even in the best of times. And during this particular time, especially with unknown, we really sort of struggle with this. So how can we help folks find a way to do this? Creating routines, whether it's a family time for dinner, whether it's doing something from a family tradition sort of standpoint. It's finding that something that keeps some degree of normalcy and a very uncharted and very unpredictable sort of time. So leverage technology, social media, Facebook, Skype, Zoom, utilize it for good, utilize it to be able to connect with one another and with folks who may be across the country. Some of the things that folks have told us that tends to be helpful and that works is watching movies together. So stream a movie together and stay in contact. Others have shared with us that having a dinner family night with another couple or with relatives or other family members in other part of the country it is not the same as sitting down with them or visiting with them, but it does provide some degree of connectedness. Seeing that face-to-face and seeing in person is incredibly important. But with social media, we're at least afforded the opportunity to be able to see some of our loved ones that we've not been able to see. Next slide, please. So others have shared that this has, while no one wishes any of this occurred, and that we would really just love to be back to normal, like we've always done, folks have shared with us that they've learned a great many things. They've shared things with their families, their neighbors, their friends, and there's a camaraderie around trying to do this. Having a virtual happy hour or tea time or coffee hour can also be extraordinarily helpful. And we've had folks who have shared with us that they've started a virtual book club and or some other community organization piece. Next slide, please. So I think, can we go one back, please? Thank you. So I think, with the advent of technology, the fact that it's so immediate, I think there's times when we've, shelved some of the tried and true forms of communicating and staying connected with others. And it may be old school, but others have found that writing a letter, mailing birthday cards, mailing something that says, I'm thinking about you, I hope you're well, can also foster a degree of connection that we oftentimes may not think of anymore. Yes, you can certainly do those things with respect to social media and on Facebook and everything else, but sometimes folks have said having that card, that letter that somebody sat down and took time to do, creating perhaps a gift. You're someone who may be able to do some crafts, or a poet, or a painter, or someone who could physically make something, write something, and others have either sent it via mail or they've even dropped it off on an individual's front doorstep as a gift and as a I'm thinking about you, hope you're well. Next slide, please. So, we often utilize, some of these approaches with individuals like yourselves who have been diagnosed with cancer, right? Trying to stay positive. We had a grand rounds this morning that talked about positivity, the power of being positivity, practicing compassion, not only to others, but to oneself, to be kind to oneself, to recognize and understand that all of us are in this together. And we certainly want all of you to know that you are not alone, that we are here. We are here to help. We are here to problem solve, to be creative. And we're here to stay connected with you as providers as well. I would also offer, so there's, a great amount of fear of the unknown, whether it be cancer, whether it be the coronavirus. When you have questions, concerns, obviously reach out to your medical professional, obviously listen to their wise advice and their very best advice and counsel on how to stay safe and to stay connected during this difficult time. Next, please. So I wanted to incorporate several resources that folks may find useful. There's a Cancer Care, which is a wonderful organization, which provides online counseling, among some other things. Pro bono counseling has always been a good resource, and the Healthy Minds app is online and free and helps folks with respect to meditation, relaxation, staying connected to yourself as a human being, and helping to stay connected with others. Thank you.
Well, thank you so much. Always great to hear you talk, and really great tips and good resources. So thank you so much for that presentation. I'd like to switch gears to talk about primary care. Dr. Kim Peart is going to talk a little bit about, hold on, let me get Kim's slides. Kim, we're going to actually switch gears and we're going to go to Dr. Ola Yeni, and we'll circle back to Kim in just a moment. 1 second, please. Are you there? Can you hear us?
Yes, hi.
Thank you so much. Sorry about the change in order.
That's okay. That's okay. Okay. Hello, this is Annie Oluyemi. I'm one of the breast imagers here at Johns Hopkins. And I'm going to be talking to you about some of the changes that we've made in our workflow as a result of the COVID-19 pandemic in order to keep our patients and our staff safe. Next, please. All right, next, please. So here in the breast imaging division, we have taken several safety precautions, which I'm gonna go over. We are screening our staff daily for any symptoms of COVID-19. We're also screening all patients over the phone and again at the entrance of the building when they arrive for their appointments. In addition to that, we have also implemented careful cleaning and sanitization procedures for all of our imaging rooms and equipment before and after every patient that comes to our clinic. Can I see my slides, please?
Sorry.
Let's go back one, please. Okay, and I just want to make a note that all of the cleaning supplies that we use for the cleaning process are approved by the Johns Hopkins Hospital Epidemiology and Infection Control Board, because we want to make sure that we're properly disinfecting all of our surfaces. Next, please. In addition, we have implemented a new workflow that allows patients to wait in their vehicles when they arrive for the appointment until the exam room is ready for the imaging appointment. We've also redefined all of our waiting rooms in order to promote social distancing, to allow for adequate spacing, and we've also implemented the use of seats that have special healthcare specific fabric that is easy to clean. Our clinic scheduling templates have also been redesigned to try to space out the appointments better to allow for social distancing. Next, please. So in accordance with the guidelines from the state of Maryland, we do require that all patients and visitors at Johns Hopkins imaging locations, that they wear a face mask or a fabric covering over their face, with the exception of children under the age of 3. In addition, all of our staff will be wearing face masks, as well as other types of protective equipment, including some face shields. Next, please. We have implemented new visitor guidelines, and this is for the safety of our patients and staff. So the guidelines state that no visitors are allowed to accompany patients to their imaging appointments unless necessary due to special needs, or if the visitor is accompanying a child that's requiring imaging. Visitors who are not necessary for care will be asked to remain in their vehicles. Next, please. We've also implemented new guidelines regarding walk-in appointments. No walk-in examinations are offered currently at any of the Johns Hopkins medical imaging locations. And this is in order to allow us to be able to screen all patients who are coming in for appointments. This is for everybody's safety. This includes no walk-ins for any patients that are coming from an on-campus clinic. Next, please. Now, in looking at the changes that have been made to our clinic schedules, we resumed screening appointments on May 18th, actually. And so we've been doing screening appointments for a little over a month now. All diagnostic mammograms, diagnostic ultrasounds, and biopsy appointments up until the end of June, so about 4 days from now, are only being scheduled at the Green Spring location in Louisville, the Bethesda location, and the Johns Hopkins Outpatient Center in downtown Baltimore. Starting July 1st, the outpatient clinics located at Columbia and White Marsh will begin scheduling diagnostic mammograms and diagnostic ultrasound appointments. Next, please. So if you have any questions about any of the guidelines or any of the changes that we've made as a result of the pandemic, please do not hesitate to call our call center at 443-997-7237 on Monday through Friday between the hours of 7:30 a.m. and 6 p.m. You could also visit our website at hopkinsmedicine.org/imaging to find out more information. Thank you.
Thank you so much. Thank you so much. We're gonna go back, we're gonna switch gears a little bit, and we're gonna go back to Dr. Kim Pierce, who's gonna share her screen and talk a little bit about primary care. Dr. Pierce, can you hear us?
I can. I think you have to stop sharing your screen for a
So
moment.
my screen is done. If you go to the bottom of your screen and say share screen.
I did. Okay, I've got it now. Wouldn't allow me. There we go. I got it. Okay. And there is, bear with me. There's a trick to getting this off, and I cannot recall what that is. There we go. Is this good? Can you see?
Not yet.
Oh. Sorry. Apologies here. Sorry. What are you seeing?
Yeah, now we are seeing, yeah, you just need to click on your slides. There we go. Perfect. Thank you so much.
Okay, great. Apologies for that. So thank you. I really appreciate all the comments made by the previous presenters, and I think I would just like to echo a lot of the points that they made. I am an internist, and I care for many breast cancer patients and breast cancer survivors, and so interact closely with oncologists and the care delivery of those patients. So I'm in control here, so I can find. So a couple of points I just want to highlight, and they're very general and probably common sense to most, but that I find myself reiterated it to patients near daily. During the COVID pandemic, the healthcare delivery system has been turned on its head, and we have tried to become very creative in giving good care delivery, keeping continuity of care, keeping in touch with our patients, and making sure we're partnering with them to have them comfortable where they're getting their care delivered. And so I think a really big part is communication in all of this, because as we've shifted to more telemedicine, I think we've become more reliant on using the electronic medical record for messaging to patients. And so I encourage you, if you're not on the electronic medical record system, to do so. And if you're not in our system, that for whatever system you use, to really engage, because it's a nice way to receive information. Things change in your daily during COVID times, and to really stay abreast with that. I also think it's important to make sure you're communicating what your preference of modality for communication is and updating contact information. I think we've found that when we're trying to call patients who would typically have come in the office and see for their care, we may be having trouble with that. And again, I know that sounds like a very simplistic solution to things, but it's really important when we're trying to keep close contact. I'd also encourage that if you see multiple providers, let those providers know you're seeing other doctors, because there's ways that we can coordinate differently and better now. I find that I'm engaging more with colleagues about patients because we know that there might be more time between when we get to see them. And it's helpful if patients remind me, oh, I'm seeing Dr. So-and-so next week, so that it puts on my radar kind of the landscape of their care. A comment about access. I think many people have spoken to that already, but you know, we are here for you, and we are seeing patients in person. We're also harnessing the power of telemedicine as much as we can, so that we can provide care in different ways. And we're trying to think out of the box with that. I think it's important to realize, and I know oncology has embraced that there are opportunities to do what we call hybrid visits, where, you know, if I see you as a telemedicine visit, but there are other things I need done, or you need to have done, like your breast imaging or labs or whatnot, that we, you know, you can have those done in person, but you might not necessarily need to see the physician every time in person. Certainly, if there are issues that need to be seen in person, we will accommodate those. And again, I'd like to reiterate here again, if you're seeing multiple providers, why it's important to make other providers aware of that is because I think there's also the potential that we can maximize your in-person visits to, you know, if there are particular physical exam findings that another provider might need, and you're with me, I can highlight those and make sure that they're documented well in the chart, so that maybe that other visit with the other provider could be done via telemedicine, so that we're not having to have you see multiple providers in person if that doesn't seem to be your preference or the right thing to do. Okay, just a word about the sort of non-cancer stuff, as I'll refer to, the comorbidities, the things that might not be breast cancer, but might a bit likely interrelate, but then may also be independent of breast cancer, and how we're handling those in the time of the COVID pandemic. I think Megan spoke to this earlier about the medications and the importance of continuing your medications. I guess I would like to just say, and again, I think this is common sense, but please don't stop anything without a discussion with your physicians. Early on in the pandemic, there was a lot of concern about the use of ACE inhibitors, which are blood pressure medications, and there was some very early literature suggesting that they could put you at higher risk for poor outcomes with COVID. And then as we got more literature on it, that has not borne out. And so, you know, I had a few patients that almost stopped those medications, and I encouraged them very much not to do so. And so the literature and the press on this changes near daily. So always touch base with your physicians about that. Similarly, if you're on things like chronic steroids for whatever reason, those types of medicines can't be stopped abruptly. And there are other medicines that are similar. So just have a conversation before you make any adjustments. Again, Megan commented about getting medications home delivered. I would encourage people, if you can, to try to get 90-day supplies if possible, so that you know, it's delivered and then you have it, and then there's no suspense that you're going to run out every 30 days, obviously if it's appropriate for a 90-day refill. Controlling your comorbidities is important. I think we saw an earlier slide with some of those disease states that we know are associated with potential poor outcomes if a patient was to develop COVID. And that includes poorly controlled type 2 diabetes and cardiovascular disease. And so hypertension, blood pressure control is important, glucose control is important, and continue on your medications for these. And then finally, if you are having symptoms, new symptoms, it's important to reach out to your healthcare provider. I always, I continually remind folks, everything is not COVID. And by that, I mean, you know, we have to have COVID on the front of our minds when patients get new symptoms, fever, cough, and that type of thing. But, you know, for me, it is June, soon to be July in Maryland, and when patients get fevers and muscle aches, I have to think about Lyme disease too. And so I just use as an example of there are other things that are that can happen, and don't hesitate to reach out to ask about symptoms. Word about preventive health. Jenny gave you a great outline of healthy lifestyle interventions, which I can't overstate their importance. I think in this time, it's incredible stress. There's a lot going on, and sometimes it's harder to get yourself to stay on regimens that you had before, particularly with exercise or healthy eating. And this may be an encouragement to try to really make that an important goal. With regards to vaccines, we don't want this falling by the wayside. I will say all vaccines are not equally urgent. If patients are going to go on immunosuppressions, we typically like to have them have pneumococcal vaccinations if they hadn't already. But many of the other vaccine series, I would discuss with your providers about the timing of those. And don't stress if you can't get them all done in a timely manner. Some obviously are more important than others. But I will make the plug that the flu shot in the fall is a must. This is going to be a challenging time when we start to see the flu, depending on where we are with the COVID pandemic. And I just implore you all to get flu shots. And then with regards to the timing of your other health screenings, again, I think these can be individualized. We don't want people to put them off indefinitely because I do think COVID's going to be with us for a while. And I think, as you heard from our radiologist, we have things open. We are taking care of patients in person. And so I think just a discussion about the timing of those. And then finally, what can you do to keep yourself healthy? I think I would suggest if you have questions about COVID in particular, the CDC website is full of fantastic information. You heard about the precautions that we have in place at Johns Hopkins. We have a very robust infection control group that has worked with all of our clinics to set standards on safety for patients coming in, for our staff and our anybody basically in the building. Again, you heard what that entails. It's screening beforehand. It's cleaning. It's social distancing. We're all wearing masks and face shields, and patients are all required to wear a mask. And so I think that is okay. If you're going to other facilities, other places to get your lab drawn, it's okay to ask if they have good safety protocols in place. And I guess, and folks ask me, how will I know? And these are sort of the questions that I think you would want to make sure that their answer to your liking. So I will stop there. And turn it back over to Alyssa.
Thank you so much. Again, my apologies for the technical issues. Dr. Olayami and Dr. Piers, I apologize about the slides issue. I'd like to go ahead and start by asking our providers if we could do a very brief Q&A. For those of you listening at home, there's a chat feature. If you have questions, please feel free to send them to us. We'll take as many questions as we can. Dr. Piers, I'd like to go ahead and start with you. I love what you said about not everything is COVID. And I think that's a really important message that we need to send to patients and providers, that we still need to look at other health and wellness. So I was wondering if you could tell me or tell our audience about those screening things like the colonoscopy, pap smears. What would you recommend for patients to do? Should they sit tight for a while, or do you think that we should still practice those screening tests?
Yeah, I think it has to be very individualized. I mean, so again, I reiterate to patients all the time, we are seeing patients, and I would prefer to have people stay on their regular scheduled preventive health screenings. But they're doing colonoscopies in the endoscopy suites, and so I would say move forward. I do know that there are some patients who are a bit reticent, and we want to do what they're comfortable with. But I think I am more than comfortable in saying move forward with your routine screening. I have no hesitation in that.
Really helpful advice. And we have a question from someone who's listening. I know you stress shots and how important that is every year, but especially this year. Is there a specific month or time of year you should get that flu shot that makes it most effective?
Yeah, so that's a great question. And I feel like my answer to that has changed this year. So typically it takes about 2 weeks before your immunity gets full boost to a flu shot. And it generally lasts about 6 months. So typically I've been telling people end of September, early October, that buys you through March, which is generally when we see somewhere in there, it shifts year to year when we see the flu. The challenge this year is, we don't there was this thought that we're going to have this second wave of COVID. Unfortunately, we're still in the first wave, and we're not seeing a decline in many places. And so, it's determining when you want to make sure that you're getting immunity to flu. We don't know when flu is going to come. Typically, it's December, January, February, but a couple of years back, it shifted earlier. So that's a lot of talk to say. I've been encouraging people probably September. As opposed to waiting to October, which I've been a little more comfortable with in the past. I do know some stores are probably going to be offering in August. In the past, I usually discourage people from getting in August because I was worried they'd lose that immunity later. But, I might even consider later August if you see them because I see them available. There's not a right or wrong. So I think September might be the sweet spot.
Great. That's really helpful. Thank you so much. Megan, I want to switch gears to you a little bit and talk a little bit. We talked a little bit about physical therapy and how this has changed in the era of COVID. And it sounds like just because, unfortunately, we're not able to go out as much, doesn't mean that some of these needs aren't going to be able to be addressed. Can you talk a little bit about your experiences and what you have found about some of your needs specifically relating to lymphedema?
Yes. So, in February, when I worked with my oncologist, he had detected a bit of increased lymphedema in the affected breast after treatment. So he recommended a course of occupational therapy to help learn some strategies like massage, stretching, and those kinds of things to help reduce the lymphedema in that breast and stay on top of it. And then COVID hit immediately. So I reached out to my colleagues in the Department of Physical Medicine and Rehab and asked, and indeed they are still seeing patients. If you asked me in January if I was going to be showing my breasts on the internet to somebody who was watching on the other side, my answer would have been no. But in fact, this appointment was incredibly helpful. The OT's name is Jo, and she was able to show me all of the exercises. She was able to ensure that I was doing them properly, and she was also able to diagnose the severity of the lymphedema, just to make sure that it didn't need some kind of advanced treatment. And she was also even able to connect me remotely to a person who designs and helps order specific sleeves and breast garments to sort of reduce the lymphedema. So it was unsettling to think about approaching the appointment in this different way, but our Hopkins network is pretty secure, and I think it was a safe and proactive thing to do.
That's really interesting and great to hear. And I'm glad you've still got the care that you needed in an alternative way. The things we learned we never thought we would do before COVID. So thank you for sharing that very personal piece. Yeah. Dr. Kuzi, you mentioned as well as Megan mentioned, and I think Dr. Sheng, you also mentioned as well, the importance of continuing your treatments and the availability for online pharmacy. And so I know at Hopkins it's something that we're pretty comfortable with, but for those of us who are listening who may not be affiliated with Hopkins, is an online pharmacy and even a 90-day subscription, which I think Dr. Pierce mentioned, is that something that's pretty common, and are most insurance covering that right now? Why don't I shoot that to you if you don't mind to start.
Yes. Yeah, most commercial insurance will cover a 90-day supply. It's especially if it goes through a mail order pharmacy. So a lot of the prescription plans prefer, some pharmacies that will deliver home, and then they actually prefer a 90-day supply. So we're able to do that. There are some prescription plans that insist on 30 days, but I've heard of some pharmacists who've been more flexible and allowed the patients to have their kind of 90-day supply ahead of schedule, and kept the billing on the back end. So that's for the oral medications. For the injections, they often go through specialty pharmacy and can be home delivered as well. A lot can be done without having the patient to go in and physically to pick up things.
Wonderful. Thank you so much for that. Donald, I want to ask you, we have a question from somebody who says that it's really been a shift with caregivers not being able to accompany their loved ones to follow-up visits, and that's been really challenging. And are there tips that you might give to caregivers to say, here are new ways that you can be supportive, even if it's a very isolating time?
Sure, Lisa, thanks. So we get a lot of that, as you might imagine, and it can be incredibly difficult for somebody to bring somebody in for an ambulatory visit and be told they have to wait outside because of safety reasons at this point. we try to help them understand that as much as it's not our preferred way to do it, we want to keep them safe. We want to keep their loved ones safe. We encourage ways to stay connected, as we talked a little bit before, around the social media aspect of it and trying to stay in touch, perhaps even FaceTiming in on a visit, things of that nature. But it is certainly a challenge for folks, and is trying to help all of us, and providers included, sort of adjust to this new normal in a way that none of us wish we had to, but we are compelled to do so. It's taken the time to listen to folks, of course, and to be able to say, yes, we recognize that this creates an additional degree of angst. We recognize that in our ideal world, we would want you sitting in OPD with your husband, as he's getting chemotherapy, or your wife as she's getting chemotherapy, because we value family involvement and family interaction. I think what we also try to do as an institution is to communicate as well as we can with those caregivers, and to help that person who might be in the chair or in ambulatory for some reason, to be able to connect with them as well. Some folks can be technically challenged a little bit, so we really try to, I think, do our best to recognize that this is not easy, and to provide the level of support and acknowledgement that we're trying to do this in the best possible way we can to keep everybody safe.
Great, thank you. Dr. Olayemi, we're getting a question about, and this is a similar question that I asked Dr. Pierce as well. For patients who may be further out from treatment, this person is a couple years out from treatment, but is due for her annual mammogram for her unaffected breast. What are your thoughts on, do you recommend that patients continue their routine surveillance for breast cancer, even if we go into a second wave?
Thank you. I was trying to signal unmute me. Okay, so that is a great question, and absolutely, yes, we recommend that you continue your surveillance. When we were at the peak of the initial part of this pandemic, when we thought, when things were first shut down, we reassessed our schedule and what we were doing. And then we made the decision for everybody's safety to stop offering screening mammograms at that time. However, we still continue to see patients who had symptoms. We continue to see patients who were at higher risk for breast cancer, or who had breast cancer in the past. So we decided, we stratified our patient population, decided who we see, and we came to the decision to stop screening mammograms at that time. What I want to say is that we will continue to put our patients' best interests in mind and issue guidelines in keeping with what will keep our population safe and what is best for our patients. At this time, though, we are definitely recommending that all patients return, get their mammograms. Definitely, patients who have had history of breast cancer should continue to get their annual surveillance mammograms. That is a strong recommendation.
Great, thank you very much. Dr. Pierce,
yeah, I would just echo the same. And I guess I also would like to say, I think what I hear from patients is, I'll just wait a little bit till this quiets down, and not to be demoralizing on a Friday afternoon, but I think we're in this for a while, and I really have concerns if somebody's waiting for that, that magic vaccine to come quickly and have us be okay. I don't think we should wait for that. So I echo those comments. We just need to move forward and continue.
Dr. Pierce, I think that's really helpful. I think we all sort of thought that this was going to be short-lived, and I know even personally I put off that dentist appointment and all the other things thinking we were in this for 6 weeks, but at least what I'm hearing, and it sounds like you're echoing the same thing, we're in this for the long haul, and it's really important to make sure that your cancer as well as your other health and wellness needs are being addressed if this is going to be here for a little while. So I have one final question, and this is going to be to Dr. Pierce, Dr. Shang, and Dr. Kuzi. The question is, we've heard in the media that cancer survivors are at increased risk for COVID. Has that been what you've experienced? And if so, are there other extra precautions that cancer survivors should be doing if they're done with active treatment to stay healthy? Dr. Shang, why don't I start with you, and then Dr. Kuzi and Dr. Pierce, I'll ask you to chime in as well.
Sure. So I think that this is kind of the concern that most of our patients have expressed, which is simply because I've had a diagnosis or because I'm undergoing active therapy, am I at a higher risk of contracting it? Is their first question. And their second question is, if I get it, do I have a higher risk of potentially getting hospitalized, being intubated, or dying from COVID? And I think that as of right now, we actually don't have great robust data to tell us definitively what the answers to those questions are. But when we look at some of the studies that have been done in China and so forth, we do see that, maybe 1% of that population in that specific study may have been, they were cancer survivors or had a history of a diagnosis of cancer. And so certainly cancer patients get COVID just like any other patient population. The concern is that the mortality does seem to be higher in cancer patients. And so I think that from that perspective, it's really important to exhibit really good hand hygiene, wearing a mask consistently, and social distancing. I think those are probably the best things that can continue as a practice behavior pattern moving forward.
Dr. Pierce or Dr. Cozy, is there anything else that you'd like to chime in on that? Dr. Pierce, from your experience, are you seeing these patients in your clinic that are getting diagnosed and maybe needing more intensive care from you?
So I would say, all cancer patients are not the same. So we're getting more literature on this, but it's still fairly rudimentary. And, we do know patients that are immunocompromised do worse if they have a more severe illness. But one cancer patient may have multiple comorbidities for a variety of reasons, comorbidities that we know portend worse prognosis, including obesity and heart disease and type 2 diabetes and chronic kidney disease. And another cancer survivor may have none of those. And that really tips the scale. We know as you get older, and the CDC has just suggested there's not an absolute cutoff of which you're at higher risk now. That 65 age has gone out. It's just as you get older, your risks for having worse outcome go up. So, being 60 is different than being 80, is different than being 40. And so, again, that's the heterogeneity of cancer survivors. And I think we're just trying to learn how cancer and cancer survivors intertwine with those other comorbidities.
Great, thank you. Dr. Cozy, anything else you wanted to add to that? I think they did a great job of summarizing.
Yeah. I mean, I think among cancer patients, there are certain types of cancer that have a higher risk. For example, patients who have highly immunosuppressive therapies, bone marrow transplant patients who have lung cancer with intrinsic lung disease or metastatic disease to lung, they are likely to have a harder time because of the location of their tumor burden. I've been very impressed with how the breast cancer patient populations in general have done well. And I think largely because of the efforts that they've put in self-isolating and taking care of themselves and minimizing exposure. I think patients who are on chemo will have a higher risk of getting it, perhaps because of the immunosuppressive component. But once you're past chemotherapy, then it's the other comorbidities that by several months, there's no exact number that we know of, but several months, I would say at least 6 months past that. It's the other comorbidities that will have a higher impact, that Dr. Pierce just mentioned.
Thank you so much. I'm so sorry we're out of time. I feel like we're getting so many great questions from the audience, and I wish I could stay and talk to you guys all day, but really appreciate Dr. Cozy, Dr. Shang, Donald Liss, Dr. Pierce, Dr. Olayami, and Megan Hosey for sharing your expertise and your experience. I know this has been really informative for me. I hope it was for you at home today. On behalf of my co-chairs, Dr. Shang and Dr. Karen Smith, we appreciate you joining us. I apologize if we couldn't get to your questions and appreciate you bearing with us with some of our technical issues today. Just as a reminder, we have our next webinar, which is going to be managing sleep and fatigue, something that Dr. Shang talked a little bit about. That'll be on July 16th at 7 p.m. Eastern time. And in August 6th, we'll have a webinar at 7 p.m. on mindfulness and meditation. I'll be sending out a link later today of an evaluation survey. As a reminder, please take just a couple minutes, fill that out, let us know how we did. We want to find out what other information you'd like to hear from us as well. Again, thank you for joining us, and I hope you have a great rest of your day. Thank you.